In this video, we will cover MRI anatomy of brain in a simple, systematic and high-yield way. So that let's begin with the MRI sequences for the brain imaging. First one is the T1 weighted image. So in T1 weighted image, CSF is dark and white matter appears bright. As we can see here, these are the CSF appearing dark and this is the bright color is the white matter. And this sequence is good for the evaluation of brain anatomy. Now the second one is the T2 weighted image, in which CSF is bright and white matter is dark as compared to the T1. So we can compare in these two images. So this T2 weighted image is best for the evaluation of pathology. And now the third one is the flare. So this is the sequence where CSF is suppressed. So we can see here also CSF is dark, but in this sequence white matter is also dark. In T1 and flare, CSF is dark, but in flare white matter is also dark, but in T1 it is bright. So this is good for the parenchymal lesions and edema. Let's begin with the axial MRI section of the brain at ventricular level. So what we see at this level is the anterior most part is the frontal lobe, posterior one is the parietal lobe, and this is the anterior horn, body and posterior horn of lateral ventricle. These are the right and left, and this is the corpus callosum. Anteriorly is the genu and this is the splenium, whereas the caudate nucleus can be seen along the wall of the lateral ventricle. And just lateral to the lateral ventricle we can see this dark structure is the thin dark structure is the internal capsule. So this is the internal capsule, and just above the lateral ventricle we see that the cortex of brain. So at this level we see this is the superior frontal sulcus, which divides frontal lobe into the superior frontal gyrus and the middle frontal gyrus, and this is the precentral sulcus. This is the central sulcus which divides the frontal lobe from the parietal lobe. So this is the omega shape structure is the central sulcus, and this is green one is the postcentral sulcus. Gyri anterior to the central sulcus is the precentral gyrus, and the posterior to the central sulcus is the, or in between the central sulcus and the postcentral sulcus is the postcentral gyrus. As we can see in this image, this is the central sulcus, this is the superior frontal sulcus, and this one is the precentral sulcus. At the level of basal ganglia, we can see caudate nucleus, which is denoted by this red color. This is the head of caudate nucleus. This one is the putamen, and this small structure is the globus pallidus, and this posterior medial is the thalamus. So these are the structure, and in between them this is the dark structure is the internal capsule. This is the anterior limb, posterior limb, and this one is the genu. So these are the structure at basal ganglia level, and we can remember as the basal ganglia capital G, which can be remembered by the C for the caudate, A for the amygdala, P for putamen, I for internal capsule, T for thalamus, A for accumbens, L for lentiform nucleus, and G for the globus pallidus. So putamen and globus pallidus also forms the lentiform nucleus. So we can remember as lentiform nucleus, or just to fill the mnemonic, it is separated that putamen and globus pallidus and lentiform nucleus. Now let's move to the coronal plane. So it is excellent for evaluating the temporal lobe and hippocampus. So first let's go from the anterior to posterior. So in anterior section we can see frontal lobe. So that is the gray white matter of frontal lobe, orbit, olfactory bulb, and gyrus recti. So gyrus recti is the part of the frontal lobe. So it is the medial and inferior part of the frontal lobe is called the gyrus recti. Just going posterior or mid coronal plane. So we can see here that is the caudate nucleus. This is the caudate nucleus. This is the lentiform nucleus or putamen and globus pallidus. So these two structures from the striatum. At this level we can see that this structure is the internal capsule. Here is the thin structure is the internal capsule, and this thin outer is the external capsule. This area is the hippocampus. We can see in this image these are the thalamus. These on either side, this is the thalamus. These are the frontal horn of lateral ventricle, and in between the thalamus this is the third ventricle. Now the coronal MRI image at the temporal lobe level. So what we see at this level is the hippocampus, amygdala, temporal horn of lateral ventricle, and the hippocampal gyrus. So we can see in this image, this is the leveled image. This dark dotted line is the hippocampus. This one is the parahippocampal gyrus. This is the fusiform gyrus, and these are the temporal lobe, superior temporal, middle temporal, and inferior temporal gyruses, and this is the Sylvian fissure. So area below the Sylvian fissure is the temporal lobe, and above is the frontal and parietal lobes. So this level is very important for the seizure, for the mesial temporal sclerosis. Now at the mid-sagittal section of brain. So in this image we can see that the corpus callosum, brain stem, third and fourth ventricle, and cerebellar vermis. So this structure is the corpus callosum. This is the brain stem. These are the cerebellar vermis. It is a midline structure. So this is the cerebellar vermis, and these are the third and fourth ventricle. This is the partially visualized thalamus. Now this is the parts of corpus callosum. Anterior is the rostrum, genu, body, and the splenium. Now let's quickly review the posterior fossa, where we see cerebellum, brain stem, fourth ventricle, and CP angle region. And this is the infratentorial structures. So we can see in this sagittal image, this is the posterior fossa. This is the posterior fossa, where you can see this is the cerebellar vermis, midline structure, and this is the brain stem. So this is the midbrain, first part of the brain stem. This is the pons, and this is the medulla. So these are the three structures forming the brain stem, and this is the cerebellar vermis, and this diamond shaped structure is the fourth ventricle. Now this is the coronal image. We can see this is the cerebellum. On either side this is the cerebellar hemisphere, and this is the fourth ventricle, and this is the CSF space or cisterna magna. In this image we can see this is the T1 weighted axial image. This is the T2 weighted axial image. So we can see this is the CP angle on either side, through which cranial nerve 7 and 8 traversing through the CP angle into the internal auditory canal, and this is the inner ear. So pathology in this region can be visualized by taking the CP angle images, and this is the cerebellar, right cerebellar hemisphere, and this one is the left cerebellar hemisphere, and this midline structure is the cerebellar vermis, and this posterior is the cisterna magna orbit. So this is the posterior fossa structure. Now the conclusion is the to make you understand the complete systematic overview of brain anatomy in different sections of MRI. And when reading MRI brain, always follow the fixed order like visualization of the ventricles, midline structures, gray and white matter, basal ganglia and thalami, brain stem and cerebellum, and extra-axial CSF spaces. So it will make easier to identify pathology in the brain. These are my references, and thank you for watching. If you like my video and it is useful to you, then like, share and subscribe.